Thank you for the opportunity to discuss our paper, which was recently published in the Journal of the American College of Surgeons. My name is Kristen McAlpine, and I'm one of the co-authors on the study entitled Timing of the Initial Dose of Perioperative Thromboprophylaxis and its Effect on Venous Thromboembolism and Bleeding Outcomes. This study was a systematic review and meta-analysis of the literature and followed the PRISMA guidelines. The objective of this study was to determine whether the time that the initial dose of perioperative venous thromboprophylaxis affected the rates of VTE and bleeding. We included studies that used the same medication for venous thromboprophylaxis, but started them at different times preoperatively, intraoperatively, or postoperatively between randomized groups of patients and reported the rates of VTE and or bleeding. We also looked at studies that included patients that received orthopedic surgery, separate from patients that looked at that received non-orthopedic surgery in a sub-analysis. Overall, we found a non-statistically significant trend towards decreased rates of venous thromboembolism with earlier initiation of thromboprophylaxis. However, we also found that there was a non-statistically significant trend towards increased rates of bleeding with earlier initiation of thromboprophylaxis. In our sub-analysis, we found that there were very few studies that looked at this question in patients that were receiving non-orthopedic surgery. And as such, we concluded that randomized controlled trials are needed in this area of patients to determine what the optimal timing of thromboprophylaxis initiation is to limit the rates of VTE, but also to minimize bleeding. We'd like to say thank you to the Journal of American College of Surgeons for publishing our paper, and we look forward to further discussion and research in this area. Thank you.